Hi, my name is Lorin Nicholson from Advanced Remedial Therapy. Today we're going to be looking at how to treat headaches and migraines. It's a simple technique that you can do even at home. If you're a therapist, it might be an extra technique you want to add to your arsenal of techniques that you can use to treat people. But today we've got Tom on the table. We're going to work on his neck here with this suboccipital release. And at the base of the skull, I'm just going to lower the table down here so that we can see this. Right here at the back of the skull, you'll feel the bony prominence at the back here, which is the occiput. And then you have the neck here, which we call the cervicals in anatomical terms. And you have the trapezoid muscle, and most people know about the traps. It comes right up here, right up behind the hairline, onto the base of the skull. And on this side, it's exactly the same, right up here, onto the base of the skull. And you'll feel the little spinous processes, which are like the little bony lumps up the back of the spine, up the back of the neck. And then there's this little ridge, or a little gap, I'd maybe call it a furrow, right beneath the occiput, right beneath the bone where the spine and the skull meet. That's where we're going to be focused on today. Now what we need to understand, if you're suffering headaches, most of the time it's a muscular skeletal restriction. There's congestion oftentimes through these sternomastoids. Tom, you want to just give us a flex there? See, here's the sternum. See that tendon running right onto the sternum? Here onto the sternocleido, because it attaches onto the clavicle, the collarbone. Comes right up here onto a bone right behind the ear called the mastoid process. And so we'll just unflex that muscle. Those muscles often become really short. If you're sitting at a computer or looking down like I am now all the time, this muscle here is going to become short. It puts a lot of pressure up on the base of the skull. And it's the same, then you've got the trapezoid muscles right up the back here, and these suboccipital tissues that start to shorten and tighten up because they're trying to hold your head up. And we're looking at a head here that's about 4 or 5 kilos, or 10 pounds. It's pretty heavy. And so these muscles are doing a lot of work all the time to try and keep this head balanced on top of the neck like this. See? So what we're going to use now is our fingers here in a kind of in a cupping shape, our hands in a cupping shape. And don't keep them straight because you'll have a little bit more strength and control by having them curved like this. And we're going to sit them down underneath that little bony furrow, just not bony furrow, but the little soft tissue furrow right underneath the occiput here. And it's just probably above the hairline. You can probably see where I am here. And I'm going to now just hold and support the head for a moment, and I'm just going to ask Tom to relax for a moment now, and I can feel him relaxing now. He's got the full weight of his head just resting on the tip of my fingers, and you can see them all in a row. See all my fingers there? In a nice straight line. And we're now going to kind of seesaw Tom's head. By just letting him relax, I'm going to take my thumbs off the side now, so that the head is just now perched there. And see it just sort of wavering a little bit? Tom's just relaxing. Just relax, Tom. There we go. And you'll see it just slowly drifting backwards as those muscles at the front, the sternomastoids, and also the muscles at the back start to stretch and start to release. And we're kind of reversing that tension that you've been building up by keeping your head in this postural position, this bad position. So anyone working on computers, looking at your devices all the time, this is a great technique to help release those tissues, and it will take enormous pressure off the base of the skull, which is where a lot of these headaches and migraines are stemming from. Just while we're waiting for it, see how Tom's now it's slowly letting go. It doesn't happen all at once, it just happens slowly. And sometimes you'll find that it happens fairly quickly, other times it may take a couple of minutes before it even moves. But just be patient. You need to be really patient with this technique. And you can see it just slowly shuddering, I guess it's way down as those muscles are thinking like, okay, it's safe to let go, safe to relax and release. And it still keeps going. And you want to bear in mind that at the base of the skull here there are a lot of what they call spindle fibres, which are very highly concentrated in what we call proprioceptive nerve endings. And those proprioceptive nerves are the little sensory nerves that tell your brain what position your head is sitting. Is it tilted to the side? Is it tilting forward? They're all through your body, your neck, your feet, your ankles, your fingers. That's where your body can tell what direction each of those joints and muscles and what they're doing without even looking at it. Your body knows where those joints are all positioned. And they're very pain sensitive structures. And so once they get under pressure, that's where you start finding the body then complains, oh, we're in trouble. It's causing pain, and that's where these headaches are coming from in the case of these muscles up at the base of the skull. I'm just going to let my hands drop a little bit further because I can feel that Tom is still just releasing a little bit further, a little bit more. It's starting to slow down a bit, but it is still releasing. You're not feeling dizzy or anything, Tom?
No. I'm fine.
If they feel dizzy, then stop the procedure. Just lift them back up into a neutral position again. You don't want to be sending anyone into some sort of a dizzy or a giddy spell. Alright, now that I've finished here, just relax, Tom, and I'm just going to now slowly cup the base of the skull, pull the head back into a neutral position again. I'm actually going to hold on to or cradle the base of the occiput here, and I'm just going to gently pull backwards towards me. Just keep a little bit of pressure on there. You're not yanking like a tug-of-war match. You're just holding and supporting it with probably medium pressure backwards towards me. And now if I just hold on to Tom and I just have a quick feel of these muscles here, wow, feels so much more loose and less restricted and congested in those muscles here at the back, the trapezoid muscles, coming around the sides here into the splenius muscles, very important. And of course in the front here, sternomastoids. Look at that, a little bit more like putty now. Nice and loose, nice and stretched out. It's going to take a lot of pressure off here, which is where your headache comes from, and the base of the skull. So Tom, hopefully you're feeling a little bit better. How's that feel now?
Yeah, it feels great.
The neck
really
feels great.
Relaxed and loose.
Awesome. Well, I hope you found this video helpful. I've certainly found it an amazing technique for releasing someone's upper cervical area here, which is fantastic if you're suffering headaches and migraines. But if you'd like to see more videos like this, please subscribe to our YouTube channel, Advanced Remedial Therapy, and our Facebook page, which is also called Advanced Remedial Therapy, and we'll stay in touch for the future. Thank you.